Final segment with our guest this morning. Come on, give us a holler if you need help with the Affordable Care Enrollment, which runs from November 1st through December 15th. There's over 200,000 of you in the state that are in a position to maybe do this. Many of you either coming for the first time like our last caller did, or perhaps someone who's already enrolled but maybe wants to find a better plan. 2 certified navigators are the folks that you can call, and we'll have the number up for you at the end of the show to help you through the process. And we've got next up, I think, is Cheryl. Cheryl, good morning. How can we help you?
Well, good morning, Nick. How are you?
Good. Nice to hear from you.
It's good. I just have well, I guess it's a little piece of advice for everybody out there. I know that if you're on Medicare, and if you have a really good relationship with your pharmacist, the head pharmacist, they can also help you choose what might work for you, especially if you go to that pharmacy all the time. Now, I've seen that happen, and I think it's a great thing.
Oh, I think that's, I'm with you on that. Whenever I am dealing with the pharmacy, I don't have a great relationship. I go to sometimes different ones, but I quiz them like crazy. I ask all kinds of questions when I'm getting whatever. Usually it's some antibiotic for strep throat or something, but I mean, I quiz them. And so what do you think? There's navigators, and part of the plan that people get will be prescription drugs. Do people ever get reference information from their pharmacists that help with the process?
Yeah, I think, pharmacists are a great resource, just like your doctors or any other healthcare professional. Once you have a plan like Medicare or a marketplace plan, it is good to talk to your doctors and talk to your pharmacists, because they might know, maybe there's a prescription that's very similar to the one that you're taking that's a lot cheaper, or maybe there's other prescription assistance for that if it's a very high cost medication. So it is always helpful to talk to your doctor or your pharmacist.
How often, I'm curious, the two of you, and you've been doing this for several years now, have you had someone when they call in for open enrollment, and maybe they were pleased with the plan they had last year, but like you said, go ahead and call anyway and just at least check in, and you were able to guide them to something with comparable coverage but saved them money? How often does that happen year to year? I mean, have you had cases like that where, like, look, there's a new plan out here that does everything, but guess what? It's going to save you $25 a month.
Definitely. That can happen, especially if they're willing to change plans. So whenever new carriers come onto the marketplace, we've seen a trend where the new carrier will have the lowest premiums because they're trying to get that market. And despite all these things that we've talked about, doctors being in network, prescriptions being covered, the bronze, silver, gold, for a lot of people, it really comes down to what can they afford, what's going to fit into their budget, and it's that final dollar amount, to fit into their monthly budget. So if people are willing to change plans, a lot of times they will get a deal. It changes from year to year, and it depends on what area of the state they're in, but we do help people.
That's why I think it's just worth looking into. Even if you're ending up paying a little bit more, maybe you're finding one that's way further suited to you, and you'll pay less out of pocket when you go for the coverage, even though, I just think it's worth checking out one way or the other, whether you're on it now or not, to see, because you might find something better. Let's go to Tony. Good morning, Tony.
Yeah, good morning, Nick.
Hey, buddy. Sure.
What I want to find out, I'm trying to find out 2 questions. Now, I'm a veteran. I'm on board to the VA, and I keep getting all these calls and all these recommendations for this Affordable Care Act and all this Medicare and all this. I don't need that. These people can't understand. If you're going to the VA, I'm already got covered. I already got some medical coverage. But the next thing is I'm dealing with a lot of seniors now, and a lot of them can't afford to pay is $140-some a month or whatever for this
the Part B premium
insurance in order to keep this stuff going after they retire. And these young people is going down and getting care and everything from the state because they have kids and all like that. That's wrong. These people done worked all their life, and they can't even get the proper insurance and the proper medication they need, all because they're senior citizens and they don't have a bunch of kids unless they're taking care of their grandkids and stuff, custody them. Something's wrong with the situation.
So to speak to both of those points, and I'm glad Tony brought up the VA coverage, because that is a question that we get. If people are going to if veterans are going to the VA for their medical services, sometimes they ask, do I still need to sign up for the Affordable Care Act? Am I going to get a penalty if I don't sign up for the Affordable Care Act? So being eligible for the VA coverage counts as minimum essential coverage, and actually,
so you cannot assign.
They are not eligible.
They don't qualify. Just like I wouldn't qualify because I work at Channel 5, have insurance. I can't. If you're in the VA,
the only way would be to relinquish their VA benefits, which they can do, but the VA advises that if you ever do that and you try to get back later, you're not guaranteed to be. So, so most people end up sticking with the VA. Same thing with Medicare. If you're on Medicare, you don't need to sign up for the Affordable Care Act. You can't sign up for the Affordable Care Act. To speak towards seniors having issues with paying their Part B premiums, there are Medicare savings programs. They're administered through the state, so you apply for them through TennCare that help people based on their income. It actually will cover their Part B premium so that they can get that amount back on their check. You know, there is an income limit, so it could be that some people are over that. They still find their Part B premium unaffordable. But a lot of people are eligible for that program and maybe don't know about it or aren't aware of it. And Health Assist, one of the numbers that we put up before, they can call that number and they will screen them to see if they're eligible for those Medicare savings programs.
Awesome.
And if they are taking care of grandchildren, they could be eligible for TennCare based on that. And then the TennCare would be like a secondary to their Medicare, and they wouldn't have to pay their Part B premium at that point. So they could just go on TennCare and have Part A Medicare. So, and we're seeing an increasing amount of grandparents who are taking care of grandchildren, or older aunts or uncles taking care of nieces and nephews. So those people can be eligible for TennCare, and a lot of times they don't realize it.
Gotcha. All right, let's go next to, I think we've got Jane. Jane, good morning, Jane.
Good morning.
Hi.
I need to make an appointment, 2 appointments, please.
Okay, well, what we'll do is, you want to talk to a navigator, right? Are you going to go onto the marketplace and get for yourself or someone else? Is this Dr. Nelson's office? No, you're not calling a doctor's office. You're calling MorningLine. And so, yeah. I'm not a doctor. Are you guys doctors?
Definitely not. Can't give medical advice.
State of the Holiday Inn Express. No, I think you've got the wrong number, ma'am. I apologize. She may have. How the heck did that happen? Anyway. By the way, though, do get your pen and paper, because at the end of the show, I'll put that phone number back up. All right, we just have a couple minutes to wrap things up. The main things people need to be aware of. It's crucial. If you don't address your situation between November 1st and December 15th, if for some reason it just doesn't happen, do you have any recourse?
So if you already have a plan and you've opted into allowing the marketplace to renew your coverage each year, they will automatically renew you in the plan that's most similar to the plan that you have right now.
Okay.
So you would be able to continue with that coverage. You wouldn't be able to go back in and change your plan. You would have to stay with that one, but at least you would have some sort of medical insurance.
But if you're Robin, who called earlier, who says she's coming on for the first time, I guess, with her family, November 1st to December 15th, you have to do it then or you're out of luck.
There are times where you can have a special enrollment period if you've had some sort of big life change that changes your eligibility. Throughout the year, you could go it's usually a 60-day window that you have to enroll after your life change. So something like moving to a different state, let's say you lost coverage, you used to have TennCare, or you used to have coverage through a job and you lost your job and so you lost your coverage. Those sorts of things could open a special enrollment period, which would allow you to enroll outside of the open enrollment period.
All right. You can't really change your coverage if all of a sudden you have some other massive medical issue, right? You have to live with what you chose and then wait until the next year to find one maybe more closely suited if all of a sudden something bad happens.
Exactly.
Okay. And again, the phone numbers, there'll be navigators around the state, whether you go in, when they come to meet with you in person, like for instance here in Davidson County, I guess you guys are here. Where's that office? Is that, where do they come?
So we actually go out into the community.
Oh, like it'd be a library community center?
Yes, so we utilize a lot of the libraries. Nashville Public Library has been very accommodating. So we're at the Green Hills branch, Bell Bellevue branch. We're actually doing an event on the final day at the Madison branch. It's reopening.
Cool.
So we'll be there right after that. The main library downtown has assistance. The Southeast Library in Antioch has assistance. Edmondson Pike Library has assistance. All the days and times vary, so I would contact the number to make sure there's a navigator there when you go. But we utilize a lot of the neighborhood
that's awesome.
branches. So
put those numbers up again, can you again, Mary Elena, just so we're clear for folks. Open enrollment, you see the dates there, but again, the Health Assist number again is for?
It's for people who are needing a medical home or prescription assistance, if they want to see if they're eligible for the Medicare savings programs I mentioned. Also, they'll send you over to the navigators if they think you're eligible for Marketplace too. So there's no wrong door here. But to get directly to a navigator appointment, the Get Covered Tennessee hotline, that's the 844-644-5443 number. That's directly to get an appointment with a navigator or a certified application counselor or a volunteer to help you.
Yeah, and if you're someplace where you can't get to one of the locations she was just talking about, wherever it may be across the state, you can deal with them over the phone. But yeah, I guess it sounds to me like you both would prefer to at least maybe see them face to face if they can come in and talk to them. And if they do, then just real quick with a minute left, what should they bring with them?
Their income, what they think their income will be for 2019.
They have to bring their tax forms? How do you prove it?
So they could bring their most recent pay stub. It just depends. If their taxes represent what their income will be next year, they can bring that. If they have employer coverage, they need to bring information about their employer coverage.
Okay, and then just basic stuff, Social Security, proof of identification, things like that.
They need their Social Security numbers for everyone they're applying for.
Yeah. Oh, that's pretty basic stuff.
And if they're an immigrant, they should bring documentation of their immigration status.
You both are terrific. Thank you so much. Wonderful that this program's here to help people. All right, you guys, good luck. Have a happy holiday. All right.
Thank you.
Thank you.
I'll be back with a programming note and those numbers again, so you can write them down right after this.
Medicare annual enrollment